Hello.
Okay. We can hear you.
Okay, thank you.
Okay. You can start whenever you like.
Okay, thanks.
You are most welcome.
I share my screen.
Yes, please.
Could you see my screen now?
Yes, we can see the screen clearly.
Thank you so much.
You are welcome.
In the name of Allah. Hello everyone, my name is Klnaz Baghdadi. I'm joining you today from Iran. I finished my PhD in biomedical engineering at Amir Kabir University of Technology in Iran. And today I'm excited to share with you some insights about EEG signals and EEG processing in a MATLAB toolbox, which is called EEG Lab. I know maybe some of you are somehow familiar with EEG and also the EEG processing. I try to explain some terminology and also some concepts about EEG, and then we are going to learn how we can use EEG Lab Toolbox for pre-processing and processing our EEG signals. If you have any question in the middle of my speaking, I will stop and I will answer your questions if you have. At first, I want to provide a definition for EEG signals or electroencephalography. EEG or electroencephalography is originated from the action potential of your neurons. When some clusters of your neurons start to produce action potential, their activity can be synchronized, and you can record such activities using some kinds of electrodes or sensors that are located on your brain. Therefore, some sources in your brain start to produce some signals, and you can record such signals on your skull by some electrodes, which we call them EEG electrode or EEG channel or EEG sensors. EEG is categorized as a non-invasive technique, but you can record the electrical activity of your brain from different levels, microscopic levels, which you can use some single unit recording electrodes. They are miniature electrodes with the size of nanometers. You have to open the skull and open the protective layers or supportive layers of your brain, and then you put such or implement such electrodes into the brain for recording the cellular activities in microscopic manner. And also you can use some electrocorticography electrodes that are flexible surfaces with some arrays of electrodes with the dimension or size of micrometers. You can easily put such flexible electrodes on your protective or supportive layers of your brain. But both of these methods are invasive because you have to have neurosurgery for implementing such electrodes. On the other hand, you have EEG electrodes that there is no need for opening the skin or skull of your brain. You just put these electrodes on your skull, and you can easily record the electrical activities of the whole brains. Therefore, single unit recording used for microscopic brain imaging, and electrocorticography is used for mesoscopic from circuit or regions of your brain. Their signals are usually called local field potential or LFP, and the EEG is the activity of the whole brain. and you cannot say that by EEG recording you have, for example, the activity of some special clusters of neuron. You have the electrical activities of the whole brain, but it is non-invasive, and it is one of its advantages over the other methods. If we want to know the EEG bandwidth and EEG amplitude, we can say that EEG bandwidth is about 0.1 to 100 Hertz. But if we move into the brain, these frequency increases. For example, in LFB signals, the frequency bands is about 200 to 300 Hertz, and in single unit recording, this frequency increases into kilohertz. And the amplitude also increases as we move into the brain. For example, the EEG signal, the amplitude of EEG signal is usually below than 100 microvolts, but when you move into the brain and use single unit recording or electrocorticography recording electrodes, the amplitude is higher. In this figure, you can see the position of the electrode of different brain imaging techniques. For example, when you use a single neuron recording, you can put the electrodes into the gray matter, but for electrocorticography electrodes, you can put them on your protective or supportive layers of your brain, and EEG electrodes is usually located on your scalp. We also had some other kinds of brain imaging techniques. For example, MEG, magnetoencephalography, which is used for recording the magnetic activity of your brain, and fMRI, which used for recording the blood oxygenation levels when your brain starts to be activation. It requests blood glucose, blood oxygen, and using fMRI, you can record such metabolisms of your brain activities. As I mentioned before, EEG signals are the activities, the electrical activities of your brain, but the electrical activities of some brain lobes or your cortex. And the name of EEG electrodes is got from the first letter of the brain lobe's name. For example, we have frontal lobe and the electrodes that are located on the frontal parts of your brain start with F, and the parietal lobe, which is associated with language or sensory integration, and the occipital lobe that is for vision, and temporal lobe that is for hearing and learning. Outside of these lobes, we have cerebellum and brainstem, but the EEG signals are the activity of these four lobes. And also we had another lobes, which is called central lobes, that is the inferior part of your parietal lobe and the posterior part of your frontal lobe, that is associated with your motor cortex. If I want to talk about the history of the EEG, we should know that Professor Hansberger was the first one who invented the term electroencephalogram or EEG. Before him, there were some other scientists who recorded some electrical activities of our body and also our brain, but Professor Hansberger was the first one who invented the terminology of EEG, and because of that, he is known as the inventor of EEG. What is the advantages of EEG over the other brain imaging techniques? Why we should know the advantages and disadvantages of EEG? When we have different options for our study or for our projects, we have to choose one of them, and based on the advantages and disadvantages, we can have or making appropriate decisions for our brain imaging techniques. One of the advantages of the EEG recording is that the EEG devices have a low cost relative to other techniques such as fMRI, and it has a high temporal resolution. I mean, what is the meaning of temporal resolution? It means that when your brain receives a stimulus after some milliseconds, it starts to produce action potential, and using EEG devices, you can record such activities in the period of milliseconds. But for example, when you use fMRI, these time resolution increases into seconds. For example, after 1 second or 2 seconds, you can record the blood oxygenation levels. Because of that, you missed some dynamics or changes of your brain activities. And because of that, EEG signal or EEG techniques is very good for when you want to study fast dynamics of your brain. It is non-invasive in comparison with some other techniques such as electrocorticography or single unit recording. Also, another advantages of EEG recording is that it does not produce sound during recording. If you have any experience with MRI room, you know that when you enter into the MRI room, it has lots of noise, sound noise, I mean. Sometimes the sound is annoying, especially for children or elderly people. And this sound is associated with the switching of the magnetic coil in the MRI system, and it is not avoidable. And because of that, sometimes this sound is annoying for our participant, and sometimes when you want to study the auditory system of your brain, the sound of MRI system can interfere with your analysis or your signals. Another advantages of EEG recording is that it can be portable. For example, when you want to study the motor cortex, when you are running, when you are walking, you cannot use fMRI system because it has a big room, and usually the system or the MRI or fMRI devices are fixed in a room. But you can use the portable versions or device headsets that is designed for EEG signals when you are walking or running or any other task that needs movement. But what are the disadvantages of EEG recording? One of the main and the most important one is that it has a poor signal to noise ratio. There are lots of noise or artifacts that can combined with your EEG signals and can deviate or your interpretation or your results. And because of that, before EEG processing, we need to clean it and pre-process the data to reduce the level of noise from the brain activities. Another disadvantage of EEG is that it has low spatial resolution. In opposite of this high temporal resolution, EEG has low spatial resolution. I mean, when you record the EEG from some parts of your brain, as I mentioned before, those signals are the activities of your whole brain, not just some parts of your brain. But in fMRI, you have higher level of spatial resolution. You can exactly say that which region of your brain is activated. But if we want to know the information about different regions or circuits of our brain using EEG, we have to use some special complicated algorithms that are called EEG source localization. And also in clinical versions of EEG devices, usually we need long time to connect all of the electrodes on the head of the participant or the patient. But in some new versions of EEG devices, some companies produce some headsets that can be easily placed on the head of the subjects or participants, and we can use it without consuming any time for connecting the electrodes. In this slide, you can see some sample of EEG devices from different companies. These two versions, in the left side, you can see the clinical versions. When you enter the clinics and maybe you have some brain diseases or disorders, some neurologists may recommend you to have EEG recording. For example, people who have epilepsy or brain tumors, neurologists use EEG signals to detect if there is any problems in your brain or not. Clinical versions usually have higher number of electrodes, but in the right side you can see the headset versions that can be easily placed on your head, and there are some caps that you can wear easily, and on these caps there are some holes that the operator can easily put the electrodes on these holes to start the recording. Some of these headsets used for example, sleep studies, sleep disorders, or some of them usually used for neuromarketing field of studies. You should be careful that studies shows that the quality of the signals of these headsets is lower than the clinical versions. And in clinics, usually they avoid using headsets when they need to have higher level of accuracy for their diagnosis. But in studies and in research projects, we usually use the headsets because of their ease of use. Okay, till now, I want to know if anyone have questions or everything is clear. Okay, I will continue.
Go ahead, please.
Okay, thank you. If I list some applications of the EEG recordings, I can say that diagnosis brain diseases or disorders is one of the most important applications of EEG. For example, for diagnosis of epilepsy, neurologists used EEG recording. In this figure, you can see a sample of EEG signals that was recorded from a patient with epilepsy or seizure. Each row shows one of the sensor or EEG channels. And as you see, before the start of the seizure, the EEG activities is like a noise, but after the onset of the seizure, you can see the EEG pattern is changed significantly, and you see a higher amplitude and a periodic manner. But after the end of the seizure, again, the EEG activity comes back to its normal shape, which is like a noisy activity. And the other brain diseases or disorders are encephalitis, dementia, head injury, brain tumors, coma, attention deficit hyperactivity disorder, and depression are some other examples of brain diseases or disorders that are currently diagnosed by EEG recording in clinics. Another application of EEG is investigating the progression of a disease or disorders. In some, as you know, in some brain diseases or disorders, there are different stages. For example, for Alzheimer's disease, the step before Alzheimer's disease is mild cognitive impairment. And if you can predict that someone may be diagnosed by Alzheimer's disease after 2 or 3 years, you can stop the progression, or you can reduce the rate of progression. So for investigating the progression or predictions of brain diseases or disorders, EEG it can be beneficial. For example, in this figure, you can see the brain map of subjects. These colorful circles are called brain map, or maybe brain topo plot. It's the top view of your brain, and these dots on these circles shows the place of EEG electrodes. This triangle shows the nose, and these are the ears. And the colors shows the power of your EEG activity. Hot colors shows higher power, and cold colors shows the lower power in decibel. And as you see, by the progression of the Alzheimer's disease, the power of your EEG, the pattern of your EEG power is changed significantly, and using such signs or such features, you can investigate the progression of a disease or disorders.
Excuse me. I mean,
Yeah,
if you repeat with someone who has Alzheimer at an advanced stage, if I do the map every day, I will get the same red colors here and.
No. If you investigate someone from healthy into
Yes.
Alzheimer's disease, you can see such patterns. For example, in the first years, it has such patterns, and in the advanced stages, the power pattern, the EEG power pattern is like this. So if you can see such patterns in a person, maybe you can predict that after 2 or 3 years, it may become as an Alzheimer's disease or other brain disease.
And in the case of epilepsy, does it affect all signals of the brain, alpha, beta, delta, theta, or it has some effect on one more than another?
In epilepsy, most of the time, the pattern of EEG, total EEG signals, not it's decomposed into the brain frequency, is changed. And when the seizure starts, the patterns like theta or alpha, but after the seizure, it's the appearance of theta or theta or alpha band stops, and again you can see the noisy pattern of EEG signals.
Okay, thank you.
You're welcome. Another application of EEG recording is investigating the effect of a treatment. For example, you want to treat depression, and you may suggest a new treatment, for example, using a new medicine, or maybe some behavioral therapy or cognitive therapy, and you want to know if your suggested therapeutic method can affect your EEG signals or not. You can record the EEG before the treatment and after the treatment. We call it pre and post treatment, and then investigate the changes. If you see any changes before and after the treatment, you can say that your treatment has some effect on the EEG pattern. For example, in this animate, you can see different brain waves, as you mentioned, delta, theta, alpha, beta, and high beta, that we will describe it in next slide. There is a change before and after the treatment, and it shows that the suggested treatment has some effect on the EEG pattern. Another application of EEG is brain-computer interface, or BCI. In some scenarios or in some events, you may lose your body movement, and you want to control a machine just by using your brain electrical activity, for example, for controlling a wheelchair or for controlling a computer game. Currently, we can use EEG signals to control the machine. For example, you want to move to the right or move to the left by your wheelchair, or maybe you can want to replace your game avatar into the right, left, top, down. There is a device that records your EEG signals, and then it can detect some features of your EEG signals and it can classify your EEG signals as when you imagine that you are moving to the right, or you imagine you are moving to the left, and based on some classification algorithm, it can detect that each intra-EEG signal is belong to which classes. And based on that, it can move the place of the wheelchair or the game avatar. Or maybe in some advanced scenarios that currently is in studies, BBI, brain-to-brain interface, we can use brain activities for knowing that our other people, for example, can think about thinking about what scenarios or what events, but it is just on our research, and we don't have such systems in a real world. But for BCI system, currently we have such systems in real world. Another famous application of EEG recording is in neurofeedback therapy. That usually psychiatrists or psychologists use these techniques for treatment of stress, anxiety, or maybe attention deficit disorders. They put some EEG electrodes on the patient's head, and the system records the EEG signals and extracts some features such as the power of your brain activities. And based on that, it detects if you, for example, in a stress state, your mind or your brain is a stress state, or maybe you lose your attention. And based on that, it gives you a feedback to a game. For example, it increase or decrease your scores in a game. And based on these rewards and punishment, gradually you can learn how you should act to keep the proper activity of your brain. And after usually 8 to 10 sessions, the patient or the participant can learn how he or she can control his or her brain activities. It's the concept of neurofeedback therapy that is used for some brain diseases or disorders. Okay, by the end of the applications, we want to continue the presentation by showing how we can name or label the EEG electrodes. As I mentioned before, the name of the electrodes starts with the first letter of the brain lobe. As you see in this figure, for example, the electrodes that are located on your frontal lobe start with F. Electrodes that are in temporal lobe start with T. Parietal lobe start with P, and occipital with O, temporal with T. And also we have two electrodes here that start with FP. It's the abbreviation of frontopolar. These are the electrodes that are placed on your forehead. And you can see some numbers beside the name, beside the first letter of the electrode name. Electrodes that are located in your right hemisphere have even number, and electrodes that are located on your left hemisphere have odd number, and electrodes that are placed on the midline of your brain ends with Z. For example, CZ means the electrode that is located on your central lobe and in the midline, or maybe C4 means the electrode that is located on your central lobe, but it is on your right hemisphere. There are two other electrodes, A1 and A2. These are the auxiliary electrodes because for recording EEG signals we need two, for each channel we need two electrodes. One of them is a reference and the other is the active electrodes, and we records or save the subtraction of the activity of these two electrodes, each electrode with its reference. And auxiliary electrodes are used for reference. We can put the auxiliary electrode in different parts of the body. Most of the time we put them on the ear or maybe on some place on our face. For positioning the electrodes on our brain, we have different systems, but one of the most famous one is 10-20 system, which means that we can measure the distance between some known points. For example, the nascent points that is in the middle of your eye, and the anion that is bone on the posterior side of your brain. And also there are two bones behind your ears, which are called masseter bones. If we measure the distance between these points and we calculate the 10% and 20% of these measures and put the electrodes on this position, we say that we position the electrodes by the montage of 10-20 system, but we have different EEG montages and systems. As I mentioned before, the EEG activity of each channels is the subtraction between one active electrode and one reference electrode. According to the place of the reference electrodes, we have two types of recording, the unipolar or monopolar recording. In this type of recording, we put the reference electrode on some place out of the brain. For example, on our ears or maybe on some place on the face. But in bipolar recording, we put the reference electrode in some place on our head. Each of them has their own advantages and disadvantages, but unipolar recording is more famous and more popular. Another terminology that usually used in brain EEG studies is the brain waves. As I mentioned in the applications, we have several brain waves. We can decompose the EEG signals into its frequency components using some techniques such as fast Fourier transform, FFT, or wavelet, or some other techniques. And using such techniques, we can decompose the brain waves, we can decompose the brain EEG signals into 5 brain bands or brain waves. Delta band, which its frequency is between 0.5 to 3 hertz, and it is associated to sleep or dreaming. Or theta, the other frequency is theta. Its frequency is between 4 to 7, and when you are drowsy or you are in a meditative state, the theta activity of your brain usually increases. The alpha activity, which appears when you are relaxed or maybe you closed your eyes but you are conscious and you are not sleepy or drowsy, and its frequency is about 8 to 30 hertz. And another brain wave is beta band, when you are alert or when you are doing your homework or something like this. It's a fast frequency of your brain. It's a fast frequency, and its frequency is about 14 to 30. And the fastest brain waves is the gamma, which usually appears when you are thinking about hard problems, or maybe you are solving some conflicts in your life, and its frequency is about 13 to 60. By increasing the frequency in your brain, the amplitude of these frequencies decreases. And you can see in this figure the power spectrum of the EEG, a normal EEG signal. As you see, by increasing the frequency in the horizontal axis, the amplitude in the vertical axis starts to decrease. But there is an exception in 10 or the alpha band, which is in between 8 to 30 hertz, and its peak in 10 hertz. Just in alpha band, you have an exception, especially in the electrodes that are located on the occipital lobe.
Excuse me?
Yes?
You're saying that when I have stress or I have some illnesses, the frequency of the alpha, say, or beta, they will increase? The frequency or the amplitude?
The amplitude, usually the amplitude, when, for example, when you are in stress, as you see in this figure, alpha band is related to relaxation or not having stress. But when you have stress,
Yes.
the alpha power decreases in comparison with the state that you had not stress. When you compare these two states with each other, you can see that the power of alpha decreases significantly.
Yeah.
And it's this biomarker of stress, alpha power.
But I'm asking about the frequency. You say the frequency will increase.
The power of those frequency decrease.
Oh, okay. So frequencies might go beyond 100.
The amplitude, I mean that the power or the amplitude of those frequency usually decreases or increases.
Okay.
But in some brain diseases or disorders, for example, in Alzheimer's disease, sometimes, for example, the theta normally is between 4 to 7, and most of normal people, their theta frequency peak is in, for example, in 6 hertz. But when someone has Alzheimer's disease, the frequency of theta band decrease, and you can see the peak of the theta in, for example, 4 hertz instead of 5 or 6.
Okay.
In such cases, the frequency decrease, but in most of the cases, the power of those frequencies decrease.
But when the frequency increase or the power of the frequency increase, it's in the same range. It does not go beyond the range.
Yeah, exactly. Yeah.
All right. Okay. Thank you. Go ahead, please.
Sure. Okay. So if you record an EEG signal and you see that the power spectrum of the recorded EEG signal is not the same as this figure, for example, it has a obvious peak on 30 hertz, it can be concluded that your EEG recording combined with a noise or artifact, and you should be careful about using such recordings before any analysis, and you should remove or reduce those noise or artifacts. Or for example, in some cases, instead of decreasing the power, you can see that it decreases and then gradually increases. Again, it says that your EEG recording has some noise or artifact, and you should remove them in pre-processing stages. But if you record an EEG signal and you plot the power spectrum and see something like this, it shows that the level of noise on your signal is very low, or maybe there are no obvious noise on your signal.
Could it be due to the bad contact of electrodes with the scalp or something like that as well?
Yeah, I will introduce most common noise and artifact. But when some channels detached from your head or disconnected from the device, most of the time there is no power spectrum, or maybe some oscillated power spectrum. You can see oscillated power spectrum. But when the EEG channel or lead is attached properly, and there is no obvious noise or artifact, the power spectrum is like this.
Okay.
Another terminology in brain imaging studies is connectivity. We have three kinds of connectivity: structural connectivity, effective connectivity, and functional connectivity. In structural connectivity, different regions of your brain are attached to each other by neurons with long axons. And we say that some brain regions are connected directly to each other, and we can detect such connectivity just with DTI imaging techniques. We cannot use EEG recording for detecting structural connectivity, but we can use EEG recording for detecting functional and effective connectivity. In functional connectivity, it means that if we consider two nodes or two places of your brain, and we record the activity of these two places, and we see that, for example, when the region 1 starts to increase its activity, region 2 starts to increase its activity as well, and they follow each other. Maybe there is no direct connection between them, but they follow their activity, and it is called functional connectivity, because their functions follow each other. But what is the difference between effective and functional connectivity? In functional connectivity, it is not important that which region is the master and which region is the slave, but in effective connectivity, the direction of the connection is important for us. For example, when node 5 starts to active.
When you say the direction, it means which start first and which follows?
Yeah, exactly. In effective connectivity is important, which region is the cause of the activity, but in functional connectivity, the direction is not important.
Okay.
And using EEG signals, we can detect just functional, and with some complicated algorithms, we can detect effective connectivity, but there is no information about the structural connectivity in EEG signals. Another terminology in EEG studies is quantitative EEG, which is usually abbreviated by QEEG. Clinicians are interested in using QEEG for their diagnosis of brain diseases or disorders. It means that by some process source or some computational algorithms, you convert the EEG signals into some quantitative measures. For example, the level of connectivity, or maybe the level of brain waves power, or some special nonlinear features, for example, the permutation entropy, or some other nonlinear features that can be extracted or calculated from EEG signals. And we can compare such values between different groups. As you see in this picture, control and Parkinson's disease shows a difference between the permutation entropy that is calculated from EEG signals. There are many features in studies that can be calculated from EEG signals. But when you start designing an EEG study, you should be careful about some other effective factors, because these factors can affect your results and can deviate your interpretations. There are many factors, such as age. When you record from EEG signals from children, the pattern or the power of EEG bands is considerably different from elderly people. So in our studies, usually we just select some range of age, for example, teenagers or elderly people or children. We cannot combine all the ages together.
Yeah, sure, but you still have to put, they don't have the same hat or the same,
Yeah.
each
Yeah,
one.
exactly.
Okay.
Yeah, exactly. Yeah, any kinds of factors that we think it can affect on your EEG patterns, we should limit them, or in some way we should control them to avoid to avoid the damages on our interpretation or our results.
Okay.
And another factor is the fatigue level or level of our consciousness. For example, when you are sleepy or you are drowsy, it can affect your EEG patterns. As I mentioned before, when you are sleepy, the theta and delta band, the power of delta and theta band increase in your brain. For example, when you want to diagnose a brain diseases or disorders, and when you record EEG signals when the participant or patient is fatigued, it can affect your diagnosis or interpretation. Maybe because of the fatigue or level of consciousness, you see such patterns of EEG. Maybe when he or she is conscious, the pattern is different. So we should be careful about the level of consciousness and the fatigue level. Another important factor is the level of blood oxygenation, oxygen, blood glucose. For example, when your participants are hungry, or maybe it lose blood oxygen because of running or something like this before the EEG recording, you should be careful that such factors can affect on your brain, on the participant's brain activities, and can again changes your EEG processing results. A mind state or mental effort is also another important factor. For example, your participants have exam before and after the EEG experiments. Most of the time, he or she is thinking about the questions in exams, and because of that, mental effort, maybe some brain powers, brain wave powers, for example, the beta and gamma band increase because of his or her mental effort, and we should avoid such activities, and we should be careful that the participants or the patients are relaxed and they do not think about attention or cognitive demanding tasks.
What about gender, men and women? Is this a factor or?
Yeah, exactly. There are many other factors such as gender. In some cases, in some brain diseases and disorders, the database, they separate EEG signals of women from men, and in some cases, some brain waves or some EEG features in women is different from men, and like age, we have different populations as normative population for different genders, and sometimes the race maybe affects on the pattern of the EEG signals. And we should be careful about any possible factors that we are not sure that if it can affect our EEG or not. And if we are suspicious about some factors, we should exclude their data in our analysis, or maybe we can suggest some study for finding if, for example, female or male has different patterns of EEG signals or not. But in most of the previous studies, it was shown that which factors can affect our study. And based on the previous studies, for example, when you want to start a study and you refer to previous studies, maybe there are some studies that say that in your scenario, there is no difference between men and women. And you are relaxed and you can combine all gender. But if you are not sure, you should separate them, or maybe you should have the same number of female and male in your study.
Can we, a student has some questions, please, an attendant.
Yeah.
Thank you so much for the explanation provided about the EEG technology. I have some questions about like several subjects. First, if we can go back to the problems that we have with the EEG technology, we can like see the noise problem.
Yeah.
Is there any way to like eliminate noise?
In next slides, I introduced some sources of EEG noise, and some of them are avoidable, or maybe we can reduce the level of those noise or artifacts during the EEG recording, but some of them are not avoidable, but we can reduce their levels in pre-processing stage. We have some algorithms that I will introduce them in this workshop for reducing the level of noise or artifact. But noise and artifacts that if they they are added into your EEG signal, you cannot reduce them or you cannot remove them, and they destroy your EEG signal, and you should exclude those EEG signals from your next analysis.
Okay, so about that subject, can we use EEG source localization algorithms to help with noise cancelling?
Using some techniques such as independent component analysis, we can find some components that are not related to the brain activities, and after decomposing the signals into its component using ICA techniques, we can remove the components that, for example, are from your eyes or maybe your heart or some other regions that are not related to your brain activities, and by using such techniques, we can remove the noise components or artifacts. I will describe ICA in this workshop.
Okay, so like the EEG source localization algorithms, can we use it like to specify the part of the brain that is producing the signal?
Yes, using EEG source localization, we can say that, for example, your frontal lobe has main role for producing those EEG activities, or maybe some other lobes, but not the internal parts of your brain, for example, the thalamus or some regions of the brain that are in a depth, because the EEG source localization, the power of EEG source localization techniques is limited, and the spatial resolution after EEG source localization is not the same as using fMRI. If you want to have higher level of spatial resolution and you want to see the depth, your brain regions that are in the depths, for example, the thalamus or different parts of the thalamus, you can use multimodal recording. Usually, scientists use EEG fMRI recording. They take spatial resolution from fMRI and temporal resolution from EEG, and they combine these temporal and spatial resolution together to have higher level of temporal spatial resolution.
Okay, I have like another question, and it's how to make EEG more dynamic. In this slide, we can see some factors which are age, fatigue level of blood oxygen, glucose, and other factors. Some of them are long-term, like age or like the gender or the race. But some of them are like short-term factors like fatigue or mind state. So how can we make the EEG technology like more dynamic with like multiple patients or different patients?
I'm not sure that I understand your question correctly or not, but I think that you asked if there is any techniques or if there is a way to have a EEG systems that is robust again, for example, against the level of consciousness or level of blood glucose or mind states that are transient or can be removed in a short period. If your question is this, it's very hard because your EEG dynamics can change by these factors. Maybe a suggestion is that you can find some EEG features. For example, when you want to diagnose Alzheimer's disease or other Parkinson's disease or other brain disorders or disease, you should find appropriate brain features or indices, EEG features or indices. If you can find some indices or some features that are robust against fatigue, blood oxygen, or mindless or something like this, it's an ideal biomarkers of EEG because such factors cannot affect on those features. But finding those features is very hard, and I think it's challenging, and it's the subject of most studies to find EEG features that are robust against different variables.
Okay, thank you so much for the explanation.
Sure.
When you say fatty, what does it stand for? Is it an abbreviation of something? Fatty factors or? Because the translator put it on the screen, fatty, F-A-T-T-Y, or you didn't say that word.
No, fatty, I'm not sure. You mean that when the level of blood cholesterol is high, what is the effect on EEG signal?
Yeah.
Or,
what does fatty exactly stand for?
Fatigue or fatty?
Yeah, fatigue.
Fatigue means...
fatigue, I know fatigue, but I thought you were saying fatty.
I mean fatigue,
Okay,
level of consciousness.
Okay. The translator put it here as fatty, so sorry.
Yeah,
Okay.
fatigue.
Yeah.
I mean the level of consciousness.
Okay.
So at this time, I want to introduce you some EEG noise and artifacts that are common in a study. But before, we should know the meaning of what is the noise and artifacts. Any signal that can be recorded by your EEG electrodes, but that signal is not generated by your brain, is a noise or artifact for EEG signals. And such noise and artifact can change your EEG patterns and can affect on your extracted EEG features or indices, and then can affect the correct interpretation and correct results and diagnosis. Therefore, we should be careful about EEG noise and artifacts. But the source of noise and artifacts in EEG recording is different. For example, we have two sources of EEG noise and artifact: physiological noise and non-physiological noise. Physiological noise or artifacts, for example, respiration, when you are breathing, it can affect on your EEG signals. When you blink, your eye movement, your electrocardiography, your electrical activity of your heart, or electromyography, EMG, which are the electrical muscle activities or glossokinetic, which is the movement of tongue on your mouth. All of these physiological activities can affect the quality of your EEG signals, and most of them are not avoidable, and we should tolerate them, and we should be careful about them in our pre-processing stages. For example, we cannot stop the heart activities in our experiments, but we should be careful about the ECG noise in our EEG signals. And there are some non-physiological sources. For example, the movement of electrodes or EEG sensors, the movement of the head bugs, I mean the cap of the EEG, the noise of the EEG amplifier, the movement of the cables, and also maybe some source. There are some sources of noise in the environment. Electronic or electromagnetic motors or devices in the environment can significantly affect on the quality of your EEG signals. Maybe computer, laptop, or some other electronic devices can change the quality of EEG signal. When your participant or patient is in the ICU or CCU room, and there are some intravenous recording or respirator, or maybe the bed vibrations can affect the patterns of your EEG signals. And also phone ringing is strong artifacts that can change the EEG activity.
Dr. Galnaz, can you ask?
Yeah.
From the EEG signal, can I know if the patient there is any cancer in his brain or not?
If such brain diseases or disorders can affect the function of your brain, for example, maybe that cancer can change the asymmetry of your brain activity from left hemisphere to right hemisphere. It can be detected by the comparison of the left hemisphere activities with the right one. But if those effects do not change the activity, connectivity, or maybe the patterns of your EEG signals in a way that you can classify them from the normal one, it's very hard. But sometimes the asymmetry changes because some kinds of these cancers can affect on one side of your brain dominantly, and by comparing the activity of those hemispheres, you may detect them, but I'm not sure. It needs experiment.
Okay, and if the woman is pregnant, can I know if she is from electrical activity of her brain? Can I know if she is pregnant or no?
In clinics, EEG is not used for detecting.
Yes, I know. Yes, I know. But I know if the electrical activity change or not.
There are some few studies on these subjects, but they try to find appropriate features that is related to pregnancy, and if we can find novel features that is robust against different effective factors, we can use them for detecting the pregnancy. But it is in research, and scientists work on the new features on EEG.
Okay, thank you so much.
Sure. For example, pregnancy cannot affect on brain waves power significantly, because brain wave powers usually change by different factors, by age, by gender, by race, or some other factors, and they are not robust against, for example, pregnancy. And we should find some other features of EEG signals that are exactly related to pregnancy. In next slides, we can see some samples of EEG noise and artifacts. In this slide, you can see a sample of cardiac ECG artifacts. You see some periodic bits on one of the EEG channels, T3A1, which means the reference was A1 and the active electrode was T3. And such periodic and regular bits shows the ECG wave. And we should remove them before any further processing. And in this sample, you can see the cardiac artifact that are the artifacts that are affected many other channels, not just one channels. It is the pulse artifact that shows when your heart starts to pump the blood. Each times that your heart starts to produce a pumpage, it produces a pulse, and it can appear on some of the channels, and we should remove them before any further analysis. In general, there is no any regular or periodic pattern in EEG signal. If you see any periodic or regular shape that is repeated periodically on the EEG signal, you can be sure that there is a noise or artifact source in the environment or maybe in your body. Another artifact is the lead movement. When the electrodes or the cables of the electrode replace or maybe moves, it can produce such low frequency on your EEG pattern. If it repeats periodically or repeated many times, it can destroy your EEG signals, and you should avoid such artifacts because it's destroyed and make it unusable, and we cannot reduce it very much by using a pre-processing algorithm. For example, you can request your participants during the recording don't move a lot or don't touch the electrodes to avoid movement of electrodes. Another artifact is salt bridge. As you see, in some cases, the activity of one electrode is near zero. When you put electrodes on the skull, on the skull, you should inject some electrolytes, such as a special kind of gels or some special kinds of electrolyte below the electrodes. It can help the proper attachment of electrode on your skin, and it can increase the conductivity of electrochemical signals. But sometimes in bipolar recording, when the distance between two electrodes are not too much, the gels of two electrodes attach to each other, and it causes the shortcut, or maybe we call it salt bridge, and makes two electrodes as one electrode, and because of that, the activity of that electrode is near zero, and it is called salt bridge artifact. If we see such kinds of artifact, we should detach the electrodes, and we should clean the gel on the skull, and then we should attach again the electrode. And sometimes the head of the participants has a higher level of sweat, and because of that salty material, two electrodes attach to each other and make a shortcut.
Okay.
Another famous and common and unavoidable artifact is the power line artifact. In some countries it is in 60 hertz, and in some countries it is in 50 hertz. And it's a high frequency noise and artifact, and it's unavoidable, but we can remove or reduce it using some band pass filters or maybe some other techniques such as ICA. If in the EEG recording room there are some electrical motors, or maybe the room beside the EEG recording room, whenever it is the motor starts about replacing such electrical motors, if there are some of them in our recording room. Phone artifact is another artifact. Whenever your mobile cell phone or other kinds of phone is ringing, it produces some patterns like this on your EEG signals. And if the number of these artifacts is high, again, your EEG signal is not, it cannot be used, and you should exclude it for further analysis, because we don't have appropriate methods for removing or reducing such artifacts. Muscle artifacts, as I mentioned, the electrical activities of your muscle can produce or can add some noise and artifact on your EEG signals. For example, when the participant move his or her neck or her body, the muscles produce EMG signals, and they are high frequency signals that can be added to your EEG signals. We should try to reduce the occurrence of such artifacts. For example, we can request the participants to control himself or herself and don't move a lot, but in some cases it is not avoidable, and we can reduce them by using some algorithms such as ICA. It is another kind of EMG artifact. When some muscles in your neck is in tension, it can reduce such spiky patterns on your EEG signals. It's the chewing artifact, and these kinds of artifacts can destroy your EEG signals. Before recording, we usually request the participant to bring out their chewing gum, but sometimes we forgot to say them, or maybe sometimes they forgot to bring them out, and during the recording they start to chewing, and as you see, it destroyed the EEG signal, and we cannot use these kinds of EEG signals. Blink artifact is another common artifact, and sometimes unavoidable. Whenever your participant blinks, you can see an artifact with high amplitude in positive or sometimes negative potential appears on your EEG signals. We can remove or reduce them by using some methods such as ICA, but as much as possible, we should avoid them. For example, we can request the participant to not blink as much as possible. Lateral eye movement is another artifact. When your participant tries to look at the left or right or up or down, and a bipolar, a positive and negative, followed by a negative, or maybe negative followed by a positive peak appears on your EEG signals. Again, you should request your participant to do not look at his or her surrounding environment to avoid producing such artifacts in EEG signals. And it is the artifacts of a laptop or an electronic system plug-in. When you plug or unplug your electronic devices, you can see such high frequency artifacts on your EEG signal, and if it repeats a lot, it can destroy your EEG signal because there is no algorithms, like the computational algorithm, to remove or to test artifacts. And it's an artifact for swallowing. Whenever your participant swallows, the muscle higher level of muscle artifacts affect your EEG signal. There are some techniques for reducing such artifacts, but you should avoid it by requesting your subject to reduce their swallowing. And the last artifact is a sniffing artifact. And when your experiment is in a way that the participant should close his or her eyes, but we request him or her to do not sleep. But because as his or her eyes are closed and maybe in long time recording, he or she becomes sleepy and starts to sleep. And as you see, there are signs of sleep. We call them K complex. Whenever you see such complex on your EEG signals, you can understand that your subject starts to sleep, and you should wake him or her up. Okay, at this stage, the introduction of EEG noise and artifact is finished. If you have any question, you can ask. If no, we can continue by using the Eeglab Toolbox.
Go ahead, please.
Okay. I will dive into using Eeglab Toolbox, but in some session I will come back to describing some other theories. I described how we can download Eeglab Toolbox from its original site in an offline video that I sent it to the conference.
Good.
I will continue by how we can install such toolbox that we downloaded before, and we can add it into the MATLAB. When you install MATLAB software and when you open it, you can see such window. It has several tabs and also a command window that the cursor is flashing in front of it, and a workspace. For adding or installing the Eeglab after downloading its folder from the original site, you can add it to the MATLAB by selecting the Set Pass button in the Home tab. There is an environment place, and in this environment there is a Set Pass button. When you click on it, a new window appears. For adding the Eeglab folder, you can easily select the Add Folder button, and then a new window for exploring for your folder appears, and you can go to the place that you downloaded your Eeglab folder. I put it in my F drive, EEG Workshop, Software, Eeglab Current. It is the folder that I downloaded from the Eeglab site, and as I mentioned in the offline video, Eeglab is an open source toolbox that you can easily download it without paying any fee. But when you download it in the compressed format, and you extract it before adding it into the MATLAB. I extracted the Eeglab current folder. If I open it, you can see the Eeglab folder with the version of those toolbox. I used or I downloaded the 2024 version. I think it's the last version. You can just select it, click on select folder. It is added into the MATLAB current path, and after I did it before, but at the first time you should do this procedure and then click on save, then close. After saving and closing the procedure, you can use Eeglab. It is installed on your MATLAB software, and you can use it by typing Eeglab. When you type Eeglab on the command window and you press enter, it starts to opening, and you see the main window of Eeglab Toolbox. It's a blue window, and as I mentioned before, it's an open source toolbox. Every time the version of these toolbox change, and you can download the new versions, but the difference between different versions is that the developers try to fix their bugs or the issues that the users reports them. In the main window of the Eeglab, there is little help. For example, it says that when you want to import data, you can use the file menu. If you want to, for example, change or make some additions, you can use the edit file or some other minor or little help. But as I mentioned in the offline video, the Eeglab has a powerful and strong tutorial and documentation in its site. And after this workshop for advanced using of its tools, you can refer to those documentations and tutorials for further and advanced analysis. When you don't import or load any data set, you can see no current data set message on the top of this window, and all of the menus are off except for file that allows you loading or importing data. The data in Eeglab is saved by the format of .set. For example, in Word, the format is docx, in PowerPoint is pptx, or Notepad is .text. In Eeglab, the format of data is .set. If you have .set data, you can easily open the file menu and select load existing data set or .set data. If you don't have any EG data, don't worry, because in the folder that you downloaded from the Eeglab site, there is a folder which is, I will open this folder. Yeah. This is the folder of Eeglab that I downloaded from the Eeglab site. In this folder, there is a sample data. The developers put sample data on it for new users who wants to be familiar with the environment of Eeglab. There is a data Eeglab underline data.set that you can use it for your learning. I will use it and load existing data set, and I search for this data, sample data, Eeglab data.set. Be careful to choose .set, not underline epochs, underline ICA, because it's pre-processed data, but it is the raw data, and we want to perform the procedure by ourselves. So I select Eeglab underline data.set from the folder that we downloaded from the site, and I select the open button. And as you see, the first window, the information in the first window is changed. It is there is some information about the loaded EEG. It says that there are 32 channels in our signal. Number of points is about 30,000. Number of epoch and events, I will describe what is epoch and events later. Sampling rate is 128. It is an important factor or parameter in EEG processing and analysis. I will describe it.
Is it 128 enough as a sampling rate? I know that it should be twice as much, but maybe if you have five times as much, it will be more even after, better.
Yeah, exactly. I will describe it now. The sampling rate means that every second, how much data you recorded from your EEG signals.
Yeah.
I can activate my pen.
I know 128 samples per second is good enough, but it's good, but not good enough. Maybe they should have taken more than that.
Yeah. It depends on the frequency that you want to study. If I want to describe the sampling frequency, as you mentioned, it means, for example, if the sampling frequency is 100, it means that in each second, your EEG device put 1,000 samples from your EEG signals.
Okay.
It means that the distance between each samples is 1 milliseconds. If you have a higher level of sampling rate, it's better because, for example, if you have a lower level, for example, something like this, and if you attach these points together, you destroyed the shape or pattern of EEG signals. According to the Nyquist frequency, Nyquist frequency says that
twice as much.
Yeah, twice. You should, at first, you should know the highest frequency of your signal, which is called Nyquist frequency, and your sampling frequency should be higher than 2 times.
Exactly.
But what is the highest frequency in your signals? As I mentioned before, the bandwidth of EEG signal is 0.1 to 100 hertz.
Yeah.
So if we want to study all the frequency bands in our EEG signals, at least we should have the frequency rates of 200, higher than 200 sampling frequency. But if we want just, for example, the beta band, up to the beta band, as we know, the beta band is 13 to 30 hertz, and the highest frequency here is 30, and the twice is 60, and maybe higher than 60 is enough for us. So by this signal that has 128, we just can study up to 64 hertz, not higher than this. And we should limit our study to this frequency. But the ideal sampling frequency, according to some study, is higher than 5 times by Nyquist frequency. It's the ideal. But if we increase the sampling frequency, it's better because we have higher temporal resolution. But we need more processing, for example, powerful RAMs or powerful system for processing such level of data. It is recommended to record your EEG signal by the higher level of sampling frequency as much as your device allows, but in processing, you can reduce or resample the EEG signals. Because for storing, we don't have any issues. We have higher level of storage systems. and we can reduce data, we can store data with higher level of sampling rate. But for processing, usually we have the error of out of memory or something like this. And for processing, we can resample the data. The recommendation is because that maybe in future you want to test some algorithms that needs higher level of frequency rate, and you cannot repeat the recording again. Therefore, for recording, it is recommended to use the higher level of frequency rate, but in processing, we can resample it. And we will learn how we can reduce the sampling rate offline in EEG lab.
Okay, good, yes.
Okay. So the sampling frequency of this signal is 108 and 128, and the next items shows the duration of recording by seconds. In this signal, we have 238 seconds of recording, about 4 minutes, yes. And the reference electrode is unknown, and we became familiar with reference electrode. Sometimes we need to re-reference the data. For example, when you want to compare your results with the previous study, and the previous study used some special reference, you should re-reference your data to make your data similar to the previous study for comparison. And there is another important option, channel locations. When it is yes, you loaded your data and it is yes, it means that the channel locations, or maybe it means the place of your electrodes was detached to your data, and when you loaded into EEG lab, it identified the EEG electrode locations. But most of the time, when you load your EEG data into EEG lab, it is no or no label only, and you should manually add or set the channel location into EEG lab, and I will describe how you can do it. ICA weights at first is no, because we didn't perform any ICA procedure, but after performing or executing the ICA procedure, it is changed to yes. And the last item shows the size of your data in megabyte. Then the first step after loading your data or importing your data is to see your data using plot data spool, the second item. By selecting this item, you can see your EEG activities over time. The horizontal axis shows the time, 5 seconds, and the vertical axis shows different channels or different EEG electrodes by their names. And using the buttons, you can go or scroll through your data 1 second by 1 second, or maybe 5 seconds by 5 seconds. Why we do it? Because we became familiar with special kinds of noise and artifacts. We can scroll the data to see if there are some special kinds of artifacts or noise in our data, or maybe our data is usable or we should exclude it. For example, when you scroll the data and you see that all the signals are destroyed by chewing artifacts, or maybe phone ringing artifacts, and there is no way for reducing or removing those artifacts, you may decide to exclude this signal from your further analysis. After observing all your signals, the next step is to set channel locations if it is no. But before going further, I will describe how you can import other kinds of data. If you don't have dot set data, you can use file import data, And then the first one, Eeglab functions and plugins. And you can see a list of other kinds of EEG formats. And it's .edf, .cnt, .eeg, or some other MATLAB file, ASCII file. Different EEG devices use different formats for their EEG recordings, but these formats are standard. For example, EDF is a European data frame that is used by many devices. And if you have different formats that are not that set, instead of going to load existing data set, you should go to the file, import data, and use the first item, and then you should find your extension or your format and select it. For example, I have .edf data, and I will by using from EDF Bio6 Toolbox. Again, a new window appears. You can explore for your data. I put in my F drive data. This is that open.edf file, which is signals from a participant when he when EEG recorded from him when his eyes was open. I open it. A new window appears. Don't change the default and just select OK. A new window wants you to name it by name, for example, open data. And as you see, number 2 data is open data. It has I mean, as it was mentioned, it's EDF file, PDF file, DAC file. You can easily download it with the folder, and I downloaded it before. I put it in the software. Again, this folder is in a compressed format. Before adding it in your Eeglab, you should extract it. Then make a copy of this file, and then go to the Eeglab folder that you set pass it into your MATLAB. When you open Eeglab current, as we see the entire folders of this Eeglab folder, there was a sample data that we used it before, and beside this sample data, there is a plugins data folder. You can open this plugin and paste the Biopsy plugins that you downloaded and extract it. Close the Eeglab and reopen it. When you reopen the Eeglab, it goes to the plugin folders and it adds any plugins folders that are in that folder and add it to the Eeglab path. As I do it before, there is BioSig folder in my plugins, ICA labels, and some others. Some of them are in your folder by default, but some of them are new. For example, BioSig is new, and at the first time that you want to import an EDF file or any other kind, for example, EEG, each of them has their own plugins, and you should download them, extract them, and put it on the plugin folder, and reopen the Eeglab, and then you can use these items. Just click on them and find your data sets and open it. Okay. As I mentioned before, the first step is to set the channel locations. I will do it by using edit menu and then selecting channel location. A new window appears. Just click on OK. Don't change the defaults. In the new window, you can select a read button here. I select this read location button. A new window appears. You should search for a file that contains the EEG channel locations. Maybe your EEG device gives you a separate file that contains your EEG channel locations. But most of the time, you should create these files by yourself. How you can do it? I again go to the Eeglab folder that I downloaded from the Eeglab site. We have EEG sample data, plugins, and also another folder which is sample logs, means sample locations. The Eeglab developers provide you some standard EEG channel locations. CAP 33 means the standard locations for 33 channels. CAP 47 means the standard for 47 and others. But before using them in your EEG signals, our signals was, as I remember, was 19 channels. I will open one of these files to see what they contain. I open the 19 channels, and as you see, there are 19 rows in this file. The fourth column contains the label of electrodes, FP1, FP2, F7, and others. And the first column shows the order of the electrodes, and the other columns shows the coordinations or the place of locations of electrode based on some polar coordinations or Cartesian coordinations. You should, before setting or selecting this file, you should check that the order of electrodes is the same as your recording. For example, maybe in your recording, the first signal is not FP1, it's FP2. Just replace it, select it, and replace it by the first line. Or maybe you see that T7 is the third signal on your recording. Just cut it and paste it in its appropriate order. And then after replacing all the electrodes, you can reorder this number 1, 2, 3, and other. Therefore, you can create an appropriate EEG location by yourself, and then you can add it into Eeglab. I don't save it. Or maybe you record, for example, 64 channels, but in provided EEG channels by the Eeglab developer, there is no 64 channels. Just for creating a 64 channels, just open the 81 channels and then select the electrodes that you have and remove the electrodes that you don't have, and then reorder them and save them with CAP, for example, 64. By such a procedure, you can create appropriate channel locations based on your data. Therefore, you should know the labels and the orders of your electrodes. And if someone else records your EEG signals, you should ask him or her to provide you the label and the order of your electrodes. Without knowing such information, you cannot going further to more analysis and pre-processing it. So I repeat it again. I and then I'm going to the place that contains the EEG channel location. Was in software, Eeglab, in sample logs, and I select the cat and pin. I will open it, and a new window appears. Just click on OK and accept the default. And after that, I will see that the EEG locations add in our in previous windows. By clicking the OK, the channel locations should be added into your Eeglab, and the channel locations should change from no to yes. But in this case, we will receive an error because that, as you see, the number of electrodes in our EEG recording is 20, but we have cap 19. We should remove one of the channels that is not related to our recording. I plot it again. I think something's happened. Error happens after selecting an appropriate EEG. I will open it again to see what happens. Okay, I will open the data again. For .set data, we use load existing data set. And for other formats, we use file import, and we should select appropriate extension for EDF file. Software, biosig. Okay. EEG data, and open that PDF. I name it open data. So at first I should remove one of the channels that is not EEG channels. I plot it again. And as you remember, there was a label channel here. It's labeled, and it's not an EEG signal, and we should remove it before any analysis. For removing a channel or maybe some parts of your data, you can easily go to tools and then, the edit and then select data. Edit, select data. In the select data window, there are some options or items that you can use for selecting different parts of your data based on different options, for example, based on time or based on channels. Here we want to remove one of the channels. In this,
can we remove some time slot, say when the eye blinks, it will give you some noise. Can we remove this?
For doing that, we have another option that I will show you. It's very hard to remove eye blinks from here. For example, here, based on time range, for example, you can remove the first 5 seconds of your data. As you see, the first 5 seconds was noisy. And using, for example, 0 space 5 means that you want, and then check the remove. You can remove the first 5 seconds of your data.
Okay.
Yeah. And if you forgot to check this box, Eeglab just keep the first 5 seconds of your data and remove the other parts. So we should be careful about checking or unchecking this box. When you want to remove, check it, and when you want to keep, you should not check it. Okay, but for removing eye blink or blinks or eye movements, there is another easier way that I will show you. For channel, we can use this item. There is a button here with 3 dots. I select it. You can see the list of channels. Just click on the channels that you want to select or you want to remove. If you want to remove more than 1 channel, you can easily hold the control button on your keyboards and then select some other channels that you want to keep or you want to remove. Here in this scenario, I want to remove label channel. I select it. It appears here. And then as I want to remove it, I will check it. And then I select OK, and this new window appears. I name it remove channel, and OK. And as you see, number 3 data has 19 channel, but the channel locations is no label. I should change the channel locations from no to yes. I going to edit channel locations, and then I just select OK. In the read locations, in this window, I select read location, and then I will go to the sample logs folder that I described it before. My drive, F drive, EG processing, EG workshop, or maybe EG software, Eeglab current. In the sample logs, we had cap 19 that I checked it before. Its order is appropriate with our recording order, and I modified it based on my recording, and then I select it. And you should be careful. There are 2 files. One of them is CED, with the extension of CED, and one of them is a logs file. You should select the logs file and then open it and select OK. Don't change the defaults. And after that, and select OK. As you see, the channel location is changed from no to yes. And you can go the next steps for further analysis. And if I want to, for example, I plot it, and as you remember, the first 5 seconds, 5 seconds were noisy. I want to remove, for example, 10 seconds, the first 10 seconds of my data. I go to the edit, select data. In this step, instead of using channels, I want to remove data based on time range, 0 space 10. And I want to remove these time steps. So I checked it and then OK. Rename it to, for example, 10 seconds. OK. And as you see, the number 4 data, the frame per report or the duration is 132, but the previous data was 142. 10 seconds is reduced. And if I plot the data again, it's number 13. If I switch to number 4, plot data, you can see the first second that was noisy is removed. And there is a label boundary, means that something is removed from here. And as you see, there is no noise at first second. Okay, I close this. The next step is to see the frequency, power spectral frequency. As you remember, the frequency spectrum of each signal has a special pattern. I will plot this spectrum by using plot, channel spectrum and map. I will remove this one. I will display a part later. And I want to plot, for example, 0.1 to 60 hertz. There is a space between. And as you see, the power spectrum of your EEG signal. And if each of the line shows one of the channels, we have 19 channels, and each color for one of the channels. The power spectrum, the axis is frequency, and the vertical axis is the power in decibel. And you see the decreasing pattern of some peaks on 10 hertz, and the drop, significant drop on 50 hertz, because some EG devices remove the power with their hardware, or maybe by default by the software. And when you record or save the EG signal, the power line was removed from it before. But in some EEG signal, power line is on your signal, and you should remove it by yourself. For example, I switch back to the first data set. That was the data set by Eeglab developers. I plot its power spectrum. Again, I remove them. 0.1 spaced 60. Okay. And as you see, it is the power spectrum of this data. You can see the alpha band obviously, and also a peak on 60 hertz. That is the power line. This data is recorded in Canada, I think, and the power line there is 60 hertz, and we should remove it before going to further analysis, because the data has higher level of power line nodes. The next step for removing such kinds of artifacts, or maybe higher level of higher frequency or lower frequency, is filtering the data. For filtering the data, I switch back to the fourth data. For filtering the data, you can easily go to tools, filter the data. And the first one that recommended as its default is the FIR filter. You can design a low pass filter or high pass filter, or pass band or stop band filter here. For example, if you want to remove lower frequency band, lower than 0.5 hertz, you can easily type 0.5 in the first text box. If you click OK, the data is filtered, and the frequency lower than 0.5 is removed from your data, and the frequency higher than 0.5 is kept.
Can you choose? Sorry, can you choose the order of the filter, or it's set? I mean,
yes. Here is the third text box, FIR filter order. You can set the order by yourself, but the default is automatic, and the algorithm sets it by default.
How much the default is? What's the order?
It's mandatory, should be even for a FIR filter, And most of the time for EEG signals, we put it, for example, between 4 to 10 based on the
Okay.
previous studies.
Okay.
But it is recommended to put it empty and allows the EEG lab for selecting the automatic and best order. But based on previous study, we can select a number between 4 and 10, but it should be an even number.
Okay.
And if you want to design a low pass filter, for example, I want to just study up to beta band. You can easily set it by 30. It means that after clicking OK, frequencies that are higher than 30 hertz are removed from your signals, and frequencies lower than 30 will remain. If you put two numbers in two boxes, you have a passband filter, and it keeps the frequency between 0.5 and 30 and remove a higher and lower frequency than these two numbers. For example, if yes, and you should be careful that this number should not be higher than your half of your sampling frequency. For example, this data has the sampling frequency of 250, and the maximum frequency range that you can study is 125. Therefore, you cannot put here, for example, 150 because it's higher than 90 star, and the EEG lab gives you an error. I select OK. It starts to filter your data and shows you again link window filter. Okay, and this window is the frequency response of your filter. It's not important, we can just close it. And if I plot the power spectrum of this data again, 0, 14, 14, or maybe as the previous 60, you can see that after 30 hertz, the power drops because we designed the passband filter between 0.5 and 30 hertz. And we just have the up to beta bands, and we cannot study the gamma band in this filtered data. And I will switch back to the first data set that we saw, a power line noise. What we should do for removing this power line noise? Again, going to tools, filter the data, basic FIR. I want to remove the frequency of 60. I just put here 58, 62. This frequency range contains the 60 hertz. And if I want to remove the frequency between 58 and 62, I just check the notch filter. If I don't check it, and if I select it, the filter just keep the frequency between 58 and 62, that is the power line noise. But if I check it, notch filter instead of passband, we have a band stop and remove the frequency between 58 to 62, and I click OK. This is the power response frequency, and I filter. This name is arbitrary and it's not important. And I want to plot the spectra again. 1 to 60, okay. And if you compare these two power spectrum, you can see the non-filtered unfiltered data has the power line noise with high amplitude or high power, but the filtered data, the power drops on about 60 hertz, and your data is free of, now is free of power line noise. After such filtering, maybe you want to change the reference of your signals. You can go to tools, the item re-reference the data. In re-referencing, you have two options, average reference and re-reference to a channel. Sometimes we choose the reference as the average of all channels. We calculate the average of all channels, and then we can subtract each channels from the average channels. In some studies, they use average referencing. And maybe you want to re-reference to one of the other channels, you can just check the re-reference data to channels and then select your new reference. For example, if I select CZ, it means that in new re-reference, all the channels is subtracted from the CZ, and the reference is CZ. The reference is usually selected based on previous study. For example, if you want to compare your result with a previous study, and the reference on that study is average reference or maybe CZ or other types of channel, and you want to compare your result, the reference should be the same as that study reference. And because of that, we need to re-reference it. But if there is no for re-referencing, we can ignore this step and just keep the previous reference, even it is unknown. And for changing the sampling rate, again, you should go to tools, and the first item, change sampling rate. And you can change the sampling rate from 128 to any other sampling rate. It is used when your recording sampling rate is very high, for example, 2000 or 1000 hertz, and you receive out of memory errors when you are running your codes. And based on that, you can reduce your sampling rate, but you should obey again the Nyquist norm. It should not be lower than 2 times by the highest frequency that you want to study. You just type the new sampling rate, for example, 16, and then click OK. And filter resample, OK, it's a name. And number 7 data, the sampling rate is 16. And in this data, you can just study up to 30 hertz, not higher than this frequency. Okay, I switch back to the first data to show you how you after setting the EEG locations, after selecting appropriate channels and appropriate parts of your EEG signals, and also changing your reference if it's needed, or changing the frequency, sampling frequency, you can jump into the processing step and, for example, plots the brain map or brain topoplot for comparing different groups, for example, the control group with your brain diseases or disorder groups for maybe different conditions. For plotting brain maps, you can just go to plot, channel spectrum maps. And in this part, you can choose some frequencies that you want to have its top plot or brain maps. For example, for delta band, which is between 0 to 4, I select 2 hertz space. For theta band, with 4 to 8, I select hertz. And for beta band, alpha band, 8 to 30. For beta band, which is between 13 to 32, I select 22, just this. And the frequency range is between 0.1 to 60. And then I select OK. It should be mentioned that I switch back to the raw data that contains the power lines. But here I just want to show you these brain maps. For example, you see in this data, delta band is higher in front of the head of these participants, and alpha band is higher in occipital regions, and beta band again is higher in frontal channels. Maybe for example, suppose that it's your healthy subject or control subject, you have the same plots for your participant that has special kinds of, for example, brain diseases and disorders, and you can compare these brain maps together to show, for example, if there is any changes between the spatial locations of alpha band, beta band, or maybe the power. For example, maybe in healthy one, the power is like this, but in people with brain diseases or disorders, the power decreases. It's kind of features or visualizations that Eeglab can provide for you. And if I want to show you how you can select, as you asked, how we can select the eye blinks, I will open this data that contains higher level of eye blinks. And you asked that how we can select some parts of the data that has parts of that have eye blinks, and how we can remove them. For example, we can going through the data, and I see an eye blink here. I can just drag it by holding the left button of your mouse and scrolling to the end of your data. You can just drag them and select them. As you see, the selected part are highlighted. And after selecting all your desired parts, you can easily select the reject button here. If I select the reject button here, it wants to name it and new or eye blink. And OK. When you do it, the number 8 data contains data that the selected parts are rejected or removed. Some of it here, there is boundary labels here. It shows that there was an eye blink here, and I removed it in previous procedure.
Oh, that's very easy. Okay.
But it is recommended to not doing such procedure if we want to have a further analysis.
Okay.
In clinicians, most of the clinicians do it, but for research study, it is recommended to remove eye blinks using some techniques such as ICA, because when you do it, you attach two parts of EEG signals that are not related in times. You remove sometimes in between, and therefore there is a jump when you attach these two signals together, and these sudden jumps may produce some frequency, extra frequency or unwanted frequency in your output of FFT or some other techniques, and you add some frequency component in your signals. Therefore, it is recommended to remove eye blinks or eye movements using ICA instead of just cropping the signal.
Okay.
And I will close it. Another important steps is using ICA for removing the remained noise or artifact. For example, by using passband, high pass or low pass or passband filters or band stop filter, notch filter, we just remove some high frequency, low frequency, or maybe the power line frequency of our signal. But we can't remove some noise or artifacts such as eye blink, eye movement, or maybe electrocardiography or electromyography artifacts from our signals, because the frequency range of these signals have overlap with the EEG frequency range. Therefore, using simple filtering techniques cannot be used for such physiological artifacts, and we should use ICA instead. At first, I want to describe ICA theory. For explaining the ICA theory, suppose that you are in a party, and in different places of the party, for example, in one place there is a child that is crying, and in some place there are some people who are talking with each other. In another place there is a person who is talking with his cell phone, and in another place there is a person who is playing a piano. If you put 4 microphones in different places of that room, each of these microphones record a mixture of sounds that come from different sources, sound source. And for example, this microphone can record the sounds of piano, or the talking of different people, or the child crying, but with different intensity. It's the same. There is the same scenario in our brain when different clusters and clusters of neurons in your brain, or maybe out of your brain, in your eyes, in your heart, in your muscles, or maybe out of your body. For example, there are power line source or electromagnetic source, that all of them produce an activity, and the electrodes are the same as those microphones, and they record a mixture of the activity of different sources inside your brain, inside your body, or outside your body. And each of these electrodes, it is assumed that their activity, for example, E1, which is the signals of the first electrode, is the linear combination of all resources that can produce activity or electrical signals. But the coefficient of some of the sources are higher than others. For example, in E1 electrode, the first electrode, the contribution of the first source, C1, is higher than other sources. The coefficient is 0.9, and some of the coefficient is also can be negative. It means that the inverse of second source has contribution to making the signals of second electrodes. And in ICA, we have the electrical activity or the signals of E1, E2, E3, or E4, the electrical activity of our channels or our sensors. But we, based on the ICA techniques, we want to estimate the existing sources and their coefficient, their contributions. And ICA algorithms in Eeglab can do it for us automatically. But in Eeglab, the default is is that the number of electrodes is the same as number of sources. For example, if you have 32 electrodes, it's the IC algorithm in Eeglab finds you 32 sources. It's the default of Eeglab. I will switch back to the Eeglab to perform the ICA analysis on our data. I will close all the window. I will switch back to the first data, but the filtered data. It's the EEG signals that was provided by the Eeglab developer, and I filtered the power line. I want to perform the ICA component. Just go to Tools menu and select Decompose Data by ICA. When you select this item, a new window appears. Don't change the defaults, just press OK. It starts to estimate the sources and their coefficients. Based on the length of your data, it's an iterative optimization algorithm, and it takes some times from seconds to hours based on the length of your data and number of your channels. And after finishing the ICA algorithm, ICA weights is changed from no to yes. And when it changes from no to yes, you can start removing the non-brain components by using tools. There is an extension in Eeglab. This one, classify components using IC label. And you should select label components. In the opened window, just select OK. And it says that I found 32 components. Which one do you want to appear? I select 1, 2, 32. It means that I want to see all the components. It starts to display all the components with their labels. I wait for completing the scenario. Okay, I should minimize it to see the labels. And as you see, there is a label below each component. For example, you see that these components is brain components by the probability of 61, or maybe this is the brain by the probability of 99%. But as you see, it says that this component, the first component, is other or maybe non-brain by the probability of 96. And when you open each of these components, you can see some other information. What is this topopulator brain map? It shows the coefficients of this component in different channels. For example, it says that the coefficient of component 1 in this channel, which is frontal channel, is higher than the coefficients in other channels. And this shows the frequency components of this component. If, for example, you see a component that has a peak in 30, 40, or some frequencies more than 10 hertz, it means that this component may be a muscle artifacts or other kinds of artifacts that has higher level of frequency. Based on this labeling technique, you can remove them from your EEG data. The components that is labeled with higher level of probability, you can remove them from your EEG signals. For example, if you want to remove the first component, you should go to Tools, Reject Data using ICA, or you can easily remove components from data. If you know the number of the components, remove components from data. Just list the number of components you want to remove. For example, I want to remove the first component, and then I said select OK. After that, for ensuring that your selected component is not an EEG data and it is noise or artifact, this window, the options in this window can help you. You can use these plot single trials, and if I maximize it, you can see the signal before and after removing the first component. There are a help in up region, right, left top of your window. It says that the black lines shows the EEG data before removing the component, and the red color shows the EEG data after removing the first component. And as you see, there is no changes in our EEG data about picking or removing the first component. Therefore, it means that it is a noise, not EEG signals. But sometimes when you remove one component, the EEG signals drops significantly and obviously. If you see that your EEG signal drops significantly after removing those components, you should cancel it. But if you see that before and after removing those components, there is no change in the amplitude of your data, you can accept removing it. And then a new name, and then OK. In this the first component is removed, but the time, duration, everything is kept. I switch back to another data that has idling. Yeah, this one. I plot the score time domain. I think it's better to number 4 data that the first second is removed. I plot it. It was the EDF file that has higher level of idling. I want to find the idling source from ICA technique and remove it by ICA instead of just cropping it. I perform the ICA lab just by tools, decompose data by ICA. Again, I choose the defaults, and I don't change the default, OK. And I'm waiting for the iterative optimization procedure for finding the sources in these sources of components in these data. ICA waits stands from no to yes, and it's ready for using the results of ICA. Classify component by IC labels component. Yeah,
who defines the defaults in this case? Who says that these are the defaults?
That's a good question. Eeglab developers, if you refer to their sites, they made lots of studies for finding the best and appropriate and optimum values for different hyperparameters in different algorithms. And based on their previous studies, or maybe studied by other scientists, they put the defaults that are mostly recommended or maybe led to best results in previous studies. But based on your studies, maybe you want to check new algorithms or new options, you can change the defaults.
Okay, thank you.
Sure. Okay. And I say that show me all the components. Here in this data, we had 19 channels, therefore we had 19 components in ICA. And as you see, for example, the first component is other, means that non-brain, with 57%. When you see such patterns that the frontal or frontopolar parts of your brain is red, it means, and the class is other, it means that it is possible that this component is for eye blink. So if you see a red or blue color in front of your head, it's possible that it is eye blink, because as you know, the source of eye blink is near to your frontal lobe. And eye blinks, as you remember, has a monopolar shape, a very high negative or positive amplitude, which leads to red or blue colors in front of the eye. And if you want to be sure, we just click on this button, and as you see, it shows you the time the activity of this component in time domain. Wow. And as you can see exactly, it is the eye blink component, and you can remove it with higher level of insurance. And I selected, and before removing this component, I want to show you the third component. Eye movement, again, are near your frontal lobe, but as you remember, eye movement have a bipolar shape, a positive followed by negative, or a negative followed by positive. Therefore, in eye blink component, in eye movement component, eye movement, there are two bipolar, left side is blue, or right side is red, or maybe left side is red and right side is blue. And if you open it and you see the time activity of these components, you can find in sometimes the eye movements. And as you see, it's the signs of eye movement, bipolar, positive with negative, and again in this time there is a positive and negative. It shows that this component, the third component, is eye movement, and if you remove it, you remove the eye movement from your EEG signals. And also the class is other with 81%. I will remove number 1 and number 2, number 3 from my data. I go to tool, remove component from data, 1 space 3. Okay. Again, I will check it before accepting. I check. You see that a red line shows after rejection of the components, and black is before rejection. And as you see, the EEG signals are the same except for the place that has eye movement. As you see here, there is no eye movement in the signals. Eye movement drops.
Yeah.
And you can remove the eye movement without cropping the signals.
Good.
Therefore, I'm sure that these two components are noise and artifact, and I accept it and rename it and OK it. Number 10 is a data set that is without the eye movement and eye blink components. And if I plot the time signal, there is no eye movement. If you scroll through the data, the eye movements and eye blinks were removed without cropping the data.
Great.
But there are some other kinds of noise and artifacts like this that maybe ICA cannot identify them, or you cannot remove them. For example, some noise and artifact, as I mentioned before, like phone ringing or chewing or swallowing or something like this cannot be identified even by ICA techniques. And in such noise and artifacts, you should crop them, or maybe if there are many repetitions of these kinds of noise and artifacts, you should exclude such data from your analysis, further analysis.
I thought chewing shouldn't be allowed at the first place. I mean, when they...
Yeah. But sometimes the operator forgets to say the participant to bring out your chewing gum, or maybe the participants avoid bringing it out, and it tries to hide it below his or her tongues, and during the recording he or she is starting to chewing. And if the operator, sometimes maybe in clinics, the operator leave the participant alone, and he or she goes for their works, other works, and the participants start to chewing, and at the end of the recording, when the operator comes back, he or she can see that the data is destroyed because the participants didn't obey the rules.
That's right.
Okay. The last things that I want to show you how you can extract them from your EEG data is event-related potential ERPs. That are some kinds of your brain electrical activities. But what are ERPs? I will show you here. When you want to study each event, for example, you want to know if you show triangle and a square to your participant, what happens in the brain? Or maybe you want to know the difference between processing triangle or a square in your brain. For performing such studies, event-related potential or ERP studies are the best. In ERP studies, you represent different events to the participants, and whenever an event is presented, for example, these events can be the triangle, the square, or maybe a click of sound, or maybe you can stimulate the tactile sense of the participant. Any other kinds of events, it can be replaced by the triangle or the square. When your brain receives this event, some parts of the brain that are responsible for responding to that event start to produce action potentials and produce electrical activities. I showed the activity of these parts of the brain with the blue lines, but the other parts of the brain have their own responsibilities. For example, some parts of the brain should keep your consciousness, some parts of your brain should keep your body postures. All parts of the brain are producing electrical activities, and their electrical activities is summed with the electrical activity of those regions of the brain that responded to that event. And below the EEG electrodes, we gather or record the combination of this blue one with the red one. I just plotted on top of the red one to show you, but you should know that it is combined. Both of these are combined with each other, and below the EEG electrode there is a combination of these two activities. But we are interested to extract the electrical activities or the electrical responses of those regions that are specifically respond to, for example, triangle or a square. For extracting these kinds of signals that are called event-related potential, means potential that are related to a special event, the common and most popular way is averaging. We repeat the presentation of the event as much as possible, and then we separate the EEG signals that belongs to this event. For example, we can make a window 1 second before the event and, for example, 2 or 3 seconds after the event. And we repeat it and make this separation by making different window. Each of the time that the event is appeared, we call it a trial. It's the first trial, it's the second trial. And when we window EEG signals, we call each of these window an epoch. So if, for example, we present the triangle 100 times or 20 times, we can extract 20 epochs from our signals. Then we average all of these epochs, and by averaging, it is supposed that EEG activities, I mean the red colors, cancel each other because they are like a white noise and they can cancel each other. But the activity of those brain regions that respond to the triangle or, for example, the square or other events, nearly the same in each repetition, and by averaging, they enhance each other, and after averaging, their red lines, which are EEG signals, cancel each other, and the blue lines, that is the ERP signal, can be concluded from this averaging. But we should, before averaging, there is another step, which is removing the baseline, because each of these epochs or each of these window has their own baseline. Some of them is 0, some of them is, for example, -2, and some of them, for example, +1, +5. And we should make all of these windows or all of these epochs by the same, we should average them by the same baseline, because if each of them has their own baseline, it can affect on the averaging, and it can affect on the shape of the ERP signals. After extracting the ERP signals, but in real, you should know that there is some remaining noise on the signals. But in studies, you see that they make them smoother by passing it from a filter, or maybe by interpolation between these noisy lines, to show the better visualization, to provide the better visualization of ERP. ERP signals have some positive and negative components, and there is a number beside each of these components, positive and negative ones. The number shows the latency of the appearance of these components. For example, P1 means a positive or maybe a pitch that appears 100 milliseconds after the appearance of the events. Or P3 means a peak that appears around 300 milliseconds after the onset of the stimulus. The 0 is the time that the stimulus or the event appears. And in a study of different brain diseases or disorder, or maybe different mental states, the amplitude and also the latency of these components become important. In some brain diseases or disorders, the latency decreases or increases. For example, in people with hyperactivity, most of the time, the latency decreases in comparison with typically developing children. For example, instead of 300 milliseconds after the onset of the events, it becomes about 200 instead of 300. Or in some brain diseases such as MS, that cause the destroy or damage of myelins in our neurons, the latency increases. For example, instead of 300, it appears on 450 and 500 milliseconds instead of about 300. Or in some brain diseases or disorders, the amplitude decreases or increases. For example, when you are tired or you are in a lower level of consciousness, the amplitude of P3 or P300 decreases considerably. Each of these components have their own meaning and their own interpretations. I don't want to enter to the description of the meaning of these components, because they depend on your experiments, the features of your experiments, and in each experiment maybe you can find that some special kinds of features or some special kinds of the participant responses can produce some of these components, or can reduce the amplitude or the latency of these components. I will give you these slides and PowerPoints, and I gathered some results that different studies reported for different kinds of components. For example, in different studies, what was the meaning of N1 or N100 or P2? And you can study this slide by yourself. I want to jump into the Eeglab to show you how you can extract ERP data by Eeglab. Eeglab can do all of the procedures that I describe you automatically, and there is no need to do any of these procedures manually. For extracting the ERPs, I'll just close our previous windows. I go to the first data, because in our first data that was for the Eeglab developers, we have events. I promised you to explain you what is epoch and events. And as you see, this data has events, 154 events, and there is no epoch because we don't extract epochs or we don't window the signals, and I will do it now. At first, I should describe you what is this data. I plot the data again. As you see, there are some labels on your EEG data. When you perform an ERP experiment, you should synchronize your EEG device with the system that presents the subjects or the participants different stimulus. Whenever the system presents a stimulus, it sends a label into the EEG recording system, and EEG recording system receives the trigger or the label and put a label on your EEG signal. In this data, the participant was requested to press a button as soon as seeing a square. So in the label, the green label shows the time that a square was presented on a screen, and the red line shows RT, means reaction time or response time, whenever the participant pressed the button or a key. As you see in some squares, the participant lost them or maybe forgot to press the button. But after each square, if the participant pressed the button, there is a RT label. And the distance between the square and RT shows the response or action time of the subject. If we want to study the response of the brain to the square, response of the brain when the subjects or the participants press the button, we should study them separately. I mean, we should study or extract ERP of square, and then we should go back and study the ERP of reaction time or response time. For extracting, I start with a square. I want to know what is the or how is the response of the brain to the square. For extracting the square signals that are related to square, you should go to Tools and then select Extract Epochs. After selecting Extract Epochs, a new window appears. And in this window, at the first text box, you should select the event. In this data, we have two events, square and RT. And as I mentioned before, we should study them separately. And first, I want to study square. And I select square and then select OK. And in the next text box, you should select the duration of the window of your signal. For example, the default is -1 space 2. It means that the window is 1 second before the square and 2 seconds after the square. You can change it easily. For example, if you want to, you can say 0 to 3, space 3. It means that at the onset of the square presentation and 3 seconds after the presentation. And you should be careful that the units of time here is in second. I put 1 second, -1 second, a space and 2. And then select OK. Again, in this window appears that wants to name it. I don't change the name. Number 11 data. As you see, number of epochs is 18. It means that before that, the number of epochs was 1. It means that number of 80 number of events was a square. And as we extract them, 80 epochs extracted, and it is ready for averaging and extracting the ERP signal. But before extracting, before averaging these epochs, I want to plot it, channel data, after extracting epoch. As you see, the horizontal axis is the time, but epochs are extracted. And you see, I selected -1 to +2. And each of the windows shows here, and each of the windows contains a square. Each of the epochs has a square and is ready for averaging. Before averaging, you should go through the epochs and see if there are some special kinds of noise or artifact. For example, there is a sudden change, for example, your laptop plugging or unplug in some of these epochs. You can easily, suppose this epoch, there is a high level of noise here that you couldn't remove it by ICA or by filtering, and it remains on your data even after ICA component removal. You can go through your data and label the epochs just by clicking on each epoch. It can be selected and it is highlighted, and you can reject this epoch, because if you keep these epochs, they can affect your averaging and change the averaging results. Therefore, because of this, you can easily go through your data and select epochs that higher level of amplitude that can affect your signal or your averaging. And then you can select reject, and your data epoch reduce, for example, from 18 to 79 if you remove just one epoch. But you should try to keep as much epochs as much as possible, because higher level of epochs helps you to reduce the EEG noise and have clear shape of ERP. For averaging these epochs and extracting the ERP signals, you can just go to plot menu and select the channel ERPs, one of them in scope or a scope array or with a scope maps. At first, I select scope arrays, then I switch back to scope maps. When you select it, it asks you if you want all of the channels, ERP of all channels. I don't change the default, and I say yes, okay. It starts to averaging the EEG channels, the EEG epochs, and extract the EEG component, EEG ERPs. And as you see, it was the ERPs of different channels. I will, if you want to maximize them, click on them. One click can maximize the ERPs. And this is the ERPs of watching squares. And you can see the P300, obviously, a positive peak that is higher in frontal lobe channels, because P3 is a component that is associated with higher level of processing and is associated with a frontal lobe. But in occipital lobe, if I maximize one of the components of these occipital lobes, you can see the early waves, for example, the N2 and P2, and after that. In occipital ERPs, you couldn't see P3, obviously, because P3 is associated with higher level of processing. That is the duty of frontal lobe or parietal lobe. But occipital lobe our lobes are related to a lower level of visual processing for a square, and because of that, P3 is not cannot be seen obviously in these ERPs. If you want to see these ERPs by their maps, just channel ERPs and with scaled maps selected. And at first, I don't change the defaults and I just select OK. In this picture, in this output, you can see different channels ERP, different lines shows different channels. And also you can see the map of one of the components. It is the components that it's later on 430. It is near to the P3 component. And as you see, these maps shows that this component, the component of the power of these components is higher in central lobes. And if you want to change to 430, you can select it by plot, channel ERP with a scaled map, the same as the previous procedure, but remove NAM by, for example, 300 or maybe 350. I select OK. To see where is the location of the activity of 350. And as you see, it's near the parietal and central lobe. And if you want to, for example, now the location or spatial locations of N200. Okay. And as you see, this component has higher level of amplitude in occipital regions and also in some parietal regions. Therefore, using such brain maps, you can see the spatial locations of brain ERPs. Therefore, if I want to summarize the main measures that we can have from ERPs is their amplitudes, their latency, and their spatial locations. Sometimes the spatial locations is changed. We expect that P3 appears, for example, near the frontal lobe or parietal lobe, but in some brain diseases or disorder, the place is changed from parietal or frontal to near the occipital or temporal regions. And for clinicians, it can be signs of a sign of brain diseases or disorders. Okay. My explanation is finished, and if I want to summarize or if I want to suggest you for further analysis, I recommend you to refer to the Eeglab site, and I will do it. Eeglab. In this site, as I mentioned in the offline video, there are some documentation and also some workshops. Some of Eeglab developers every year hold workshops, but they put some of the video of some of their workshops on their site, on their sites for free, but they are limited. But the documentation is full of information, and you can find advanced analysis and advanced studies in their documentation, and you can find more information from different plugins in the description of the plugins. For example, you can search through this description and maybe you find some of them interesting. For example, there are some plugins or extension for BCI studies. I explain what is BCI, brain computer interface, and you can download them and you can refer to the site of these plugins and high density EEG recording system with 256 electrodes. And in such cases, a 1020 system cannot be used, and you should go to other special montages for placing a higher number of electrodes.
Okay, thank you very much. It's been
Sure.
really great to listening to you.
Thank you so much for your attention and your time.
We hope to see you in the future as well, and maybe you come to Syria and do it here.
Thank you. It's my honor to be here, and thank you for your invitation in your conference. And I hope you to have interesting time and be in good health in future.
Yeah, we did. Thank you.
Thank you. Bye. Goodbye.
Goodbye.